Hi and welcome to my little chat today about hamstring tendinopathy. This is one of the most common kind of chronic conditions that I see as a yoga teacher. Hamstring tendinopathy can occur because there has been a significant hamstring injury, a tear, or a partial rupture. Or sometimes it can just be because there is a weakness or a lack of flexibility around the hamstrings themselves. And in the yoga practice, there's a lot of repetitive movements that start to exacerbate hamstring condition. So whether you have tight hamstrings or perhaps you have a combination of tight and or weak hamstrings, tendinopathy occurs at times because of this repetitive motion happening and a series of micro tears starting to occur around the tendon. So the hamstrings are a set of three muscles: semitendinosus, semimembranosus, and biceps femoris. And they all attach at our sit bones. Coming down the backs of our legs, they also insert or attach down on the back of the tibia behind the knee. And so the most likely place that we are going to experience hamstring tendinopathy is up around those sit bone areas. And it can present as a dull ache, a feeling literally of a pain in your butt. And it can be exacerbated, as I said, by these repetitive motions, but also just in your day, you might feel it aching or being triggered when you're seated, when you're driving, and when you're doing repetitive movements that start to ask a little bit more of your hamstrings, like bending forwards, for example. And so how to treat this kind of a phenomena is a twofold process. First of all, I would like to say that I'm not a physio, and I would definitely recommend you go and see a physiotherapist about this. But as I have suffered this phenomenon myself, this injury myself, I wanted to share some things that you might want to be aware of. The twofold way of treating this kind of an injury or an issue is for you to modify your yoga practice straight away. This needs to happen. Okay, otherwise you're going to keep re-injuring, keep exacerbating the condition. And we need to step away from doing that. We don't want to instigate more injury. We don't want to exacerbate more issues. If we keep doing this and we don't heal this injury, it can lead to degeneration of the tendon, and it can create lots of other issues that are harder to fix if we don't actually heal it well from the get-go. The second way, so I said twofold, the second way of us healing this injury, the hamstring tendinopathy, is for us to work with rehabilitation movements. And this will start to allow us to strengthen if we have any kind of weakness through the hamstring by using eccentric contraction. So the eccentric contraction way of working with our bodies is putting our muscle under load while lengthening it. So we're kind of strengthening and lengthening at the same time. And I'll show you a few different techniques so that you can start to work with this. Of course, under advice also from your physio. Today we're going to have a look at some exercises that will just start to take down some inflammation and start to strengthen the hamstrings. And then I'm going to show you a few ways you can modify your practice. All right, I'm just going to have a quick look at my notes because I did make some notes here. I think I've got everything. One more thing I wanted to mention as far as your rehab is that it is probably a good idea for you to use cold, like ice packs. So sitting on an ice pack underneath your sit bone or seat bones, depending if you've got them on both sides, these tendinopathy. And you would apply that for 20 minutes after you've exercised, and then every 2 to 4 hours throughout your day. Okay, just while it's in those acute stages. All right, I'm going to place this to the side. I'm going to get rid of this chair that I'm sitting on, and I'm going to show you a couple of movements that will help you start to rehab this injury. One of the first movements is normally with a TheraBand, and I don't have one here to show you the full movement with a TheraBand, but I can show you the movement pattern and you can add the TheraBand. So you'd step through your TheraBand, it's around your thighs, you'd bring your hands to your hips, or maybe you'd stabilize with one hand on the wall. And with the injured hamstring leg, you would start to take that leg slowly back, sliding your foot along the ground. So you're gently feeling a contraction through the hamstring. You want to squeeze the back of your hamstring and then lifting your heel gently off the ground into hip extension and then sliding your foot back. So we slide the foot along the ground. This represents you having some contraction, some control, and then slowly sliding it back in. And you would do this 12 times for each session, and you will take 3 sessions through your day. So in the morning when you get up, a concentrated hip extension, using that sliding action, a contraction at the back of the hamstring, especially near the seat bone. And you do that breakfast, lunch, and after dinner. All right, so you can do that obviously on both sides if both hamstrings are affected or just one. The second way we can start to work with hamstring tendinopathy and rehabbing it is to work with bridge pose. So coming down onto your back, you can try this with me now as you rest your body down onto the ground. Setting your feet at hip width, making your shoulder blades comfortable under your back, starting to push down through your feet and starting to energetically lift up through your seat bones, your hips. Now we come up to the full range to feel our exploration of that and where that is. But then we come down to the halfway mark. And as you walk your feet just a little bit closer, you can either just keep your socks on and slide one of the heels or the leg that's got the tendinopathy, that heel forwards and away, and then gently drag the heel back in. So it's a simple action of sliding the heel away. Keep drawing your heel, the standing or the grounded heel, towards your buttocks, and then draw the sliding heel back in. So this is a way of working with the rehab motion, and that's halfway down, not at your maximum, but halfway down. And you could do that 12 times for each session. Again, just 3 sessions, so morning, lunch, and after dinner. Okay, and then you'd work with the full progression. So after about a week of doing that, then you'd lift your hips up a little bit higher, come to more of a range, and then starting to work with the heels sliding out, and as we did prior, just sliding it back in. All right. Another way we can work with rehabbing hamstrings is to start to come onto the heels as you lift up into bridge. And then pulsing from the full range down to the halfway point. Keep squeezing the heels back towards your buttocks, lifting up your hips, full range, and then back to the halfway point. All the time the heels are squeezing to the buttocks, lifting up to full, and then hovering down low. So you can do this 12 times, and again 3 sessions as you're working with the hips coming up to full range and then halfway down, and then lowering feet down and hips down to the ground. Once you've progressed through those 2 ranges over about a 1 week period, 2 weeks perhaps even before you get to this next stage, you would raise your hips up, and then as you come to that full range, you could start to walk the feet in a little bit closer, come up onto the heels,
And then transfer the weight to one foot and lift up the other leg. Now you can work with the halfway point and then up. Squeezing the hamstring at the back, halfway point and then up. Halfway point, just pulsing so you get the idea. Place the heels down, feet go flat, and slowly lowering your hips down to the ground.
Another way you might like to work with hamstrings, and this should all be explained by your physio, by the way. They'll probably give you pretty similar exercises. You could use an exercise ball. I don't have one, a Swiss ball, so we're going to use the stool today, a little chair. And as you press your feet, your heels on top of the chair, you come up into a lifting of your hips and your buttocks. Now we push down through the heels, we squeeze the hamstrings strong. We try and feel into our own sense of proprioception of where our hamstrings attach to the seat bones, and we squeeze the buttocks there, hamstrings as well, and we slowly lower down. And then we just use the stool or the Swiss ball to press down into, stabilize, hold for a little while, maybe 3 to 5 seconds, and come down. And you do that again for the same kind of regime, 12 times, 3 times a day. All right. So there's a few things for you to consider as you're rehabbing your hamstring tendinopathy. I wanted to show you a few things in relation to modifying your yoga practice. But first of all, just a brief explanation. Anything that puts your hamstrings in range or coming to full range is going to be an issue. So considering how often that happens in our yoga practice, quite a lot, I wanted to highlight a few poses that you will need to be really careful with. And the first one is downward facing dog. And the second one is forward fold. They're probably the two poses that you're going to encounter the most, and they're the most repetitive poses. So let's address those first. Roll out my yoga mat. And maybe you're getting ready at your end too. Come and join me. All right, so let's have a look at downward facing dog. As you bring your hands to the mat, as you step your feet back. Notice how in downward dog, you've got this really high apex of your seat bones up towards the sky. And your teachers will encourage you perhaps to bend your knees and to access a really long flat back by lifting your seat bones nice and high. Now, what I would say to you is to not come into that anterior tilt as much as you normally do in your regular classes. You might make your down dog a little longer, so you can walk the hands away from the feet. And you might really concentrate on pulling your seat bones down to the backs of your knees. And so try that on as you step your feet wider in the base of your down dog. Don't worry about lifting up your seat bones, so don't have to take a big exaggerated bend of the knees. A little bit of a bend in the knees is fine though. And then we pull the seat bones, so we squeeze the muscles of our butt right around your butthole, and you pull your seat bones down towards the backs of the knees. And this is protecting your body from overstretching or exacerbating these little micro tears that happen with the tendinopathy condition. So watch out for any short downward dogs or walking forwards, okay? You want to be really cautious with that. You might bend your knees and you might just kind of walk with really bent knees forwards. And then forward fold, as we come to forward fold, a lot of the time we're taught to just let our bodies fold forwards, exhale, drop our heads, and to tilt our seat bones up as we drop our heads and hearts down. Now, what I would recommend, if you are already suffering from tendinopathy, you'll feel a dull ache after every time you do yoga in your butt, maybe even while you're doing yoga. And so I would recommend that you bend your knees and just take a gentle kind of crouching here. And this will be your forward fold for a while. Okay, and depending on how disciplined you are with this is how quickly you'll heal. And also how well you do this will also influence whether you end up with any degenerative issues from having the injury in the first place. Okay, so try and be disciplined in what you're doing. I know it can be frustrating sometimes and you just feel like coming into the forward fold because it's what you do. Go a little bit slower in your yoga practice. Be prepared to be a beat or two behind everyone else because you're going to need to really wire your brain to make the change. So this might be your forward bend for a while, just right here. Okay, so we have to watch the halfway lift, but at the same time, the halfway lift is a really good place to strengthen. So putting that eccentric loading into the hamstrings, strengthening while lengthening. So if we come to a halfway lift, it's just here. We're basically in this position. And then we can start to really strengthen the hamstring attachments by pressing the heels deeply. So really push your feet down and squeeze your sit bones, right where your butthole is, that area, in towards each other. So seat bones squeeze in and it's like you're pulling them towards each other, kind of closing them in behind you. The other cue that might work is the one that I spoke about earlier, which is we pull the seat bones down to the backs of the knees. So see which one of those works for you. And then from there, I would start to work with standing up with hands on hips, pushing down the heels, pulling the seat bones to the backs of the knees, and coming up with a flat back to standing. So the difference between flat back to standing and rolling up for someone with hamstring tendinopathy is huge. When we roll up, we tend to really start to work with your spine and the hips, and it can just put a little bit more strain, especially if we're coming from a really low point. Might not be as bad if you come from this point, but again, whether you're rolling or flat backing up, really pull the seat bones either together or down towards the backs of the knees. When you step forwards in downward dog to a standing pose, I would go very gently with this and just take a position that has a shorter stance. Example, crescent lunge. We step the right foot forwards. We have our feet at hip width. And there's a feeling again of really anchoring in the feet and drawing the seat bones towards each other. So we scissor through the legs. We feel the inner thighs switch on. And then we engage the muscles around the hamstring attachments, so the glutes and the top of the hamstring muscle itself where it joins into the tendon. We hug, hug, hug in. So it's like you're really starting to create a firm butt, tight butt. Okay, and then any transitions, you're going to have to go really cautiously and slowly. There's lots of ways we can go to different postures from the crescent lunge. Sometimes we're encouraged to lean forwards. Now you're going to start to feel pulling on the hip that is flexed. So this is the right leg is, the hip is flexed. You'll start to feel it pulling. And so you would go very gently. And for a twist, you might just turn your body like this. So turning very slowly. I'll do it on the other side so you can see. So what I'm just warning against is coming down really low, coming into really deep hip flexion, because it's going to ask more of this attachment point here. Okay, so instead of coming really low, lengthening and then twisting, what about you stay a little bit more upright, you squeeze the seat bones together and you use your hands, one on the hip, one on the outer thigh to turn into the twist. Okay, you're going to have to modify your practice for a while. Again, be aware of anything that has a forward bend in it. Standing splits, for example. If you're coming to a standing splits, use blocks stacked under your hands. So if I just use this stool here, like a stack of blocks. I know it's higher than 2 blocks would be. But you want to use a chair or something out in front where you can raise your leg and it's not going to put too much strain on this standing hip. Okay, so you might stay more with a flat back. You might just bring one hand to the supporting leg. Go minimally, and if you would like to do some rehab while you're in the class, you could pulse the back leg, just like we were doing with the TheraBand earlier. But you just work really minimally, and that's something that you need to be dedicated to if you want to heal this injury. All right, I think that's all today. If you'd like to shoot me any questions about that, definitely can help. But do see a physio and just get their advice on, first of all, the level of your tendinopathy. Might have been going on for a while. And what they say about the different rehabbing exercises you can do. Feel free to contact me in regards to any yoga modifications. Thanks for practicing with me today. Namaste.